Angels Care Home Health, serving Hayes and the surrounding areas, is a Medicare-certified home health agency providing quality skilled nursing and restorative therapy services to patients in their homes.
They're polite. They just take the time for you.
Angels Care is there to help 24 hours a day, and all services are covered 100% by Medicare for patients who are eligible.
I like the Angels for what they've done for me.
Angels Care Home Health. We serve patients.
Eagle Community Television presents Community Connection with your host, Mike Cooper.
Hello and welcome again to Community Connection from Eagle Community Television. Thanks for watching. Thanks as always to the producer of our series, Jeff Durrell. We're at Stru Paul on the campus of Fort Hays State University as we talk about the Nightingale experience, what that's all about, and also the School of Nursing at Fort Hays State with Assistant Professor of Nursing at Fort Hays, Jana Zeller, our Community Connection. Well, we are at Stru Paul in one of the labs, I guess,
Yes.
Jana. Tell us what we have here.
You're currently in the OB lab, and so you get to see laboring mothers, cribs and bassinets, and then our peds station back there with our pediatric patient.
So this covers labor, delivery, and then pediatrics in this one room then.
Yes, and postpartum periods and prenatal care.
So this covers all of the areas of the birthing experience then, huh?
Yes, yes, yes.
Tell us about the nursing program. One part we've seen here in the lab. What about the nursing program at Fort Hays State, Jana?
Every semester we take 30 students, and they have an application process, and the committee selects the students that would be accepted each semester.
And what about numbers? What are we talking about in nursing student numbers over the years, Jana?
Like I said, we take 30 each semester. Usually we are a full 30, and sometimes we even have a waiting list. So we do have a full house usually.
That's good to know.
Yes.
What are the opportunities for the graduates in nursing?
Our graduates, they go all over the state, sometimes out of state, and they work in many different departments. Some start on medical and surgical floors, others go to ICU. We've had them go to ER, operating room, many different places, labor and delivery.
Now, are these determinations of where the nurses wind up, are they done by the nurses themselves, what they're mainly the area of their interest, or is it determined by the job opportunities?
I think mostly they choose because they find their niche in nursing. I think that's where they like to be.
And a lot of different areas then for students to perhaps explore and participate in.
Most definitely, yes. Here on campus, we do teach OB lab, pediatrics lab, critical care, and then just general med surg. We do a lot of that, so they get a wide variety of things here.
What about home care and things like that? This has been a new area of expansion, Jana, where nurses might be able to assist in caring for those who are still in their home or who might need a little extra help.
The students do a rotation with home health, and then they also do a hospice rotation, and we have a hospice simulation as well.
The Nightingale experience involved 33 high school students,
Yes.
right, Jana?
Sophomores and juniors.
That was started back in 2002. What's that all about? What does it do?
We reach out usually to their guidance counselors, and they show the flyer to their students, and anybody who's interested in nursing or even a medical profession, they apply to the Nightingale experience, and then we accept students based on their acceptance application and then their reference letters.
Do they also have some other criteria? Application, of course, obviously, grade points, interests, things like that might work out?
We usually ask interests, and then their reference letters, maybe somebody who knows them well, a teacher or a nurse or somebody like that.
What does the Nightingale experience give as far as experience for the students?
Well, the students get to first get into the department, so that's wonderful. And then they get to come into the lab, and we show them different skills that nurses do. They learn about the curriculum and the classes that they'll have to take, as well as acceptance criteria and things like that.
They also see the Fort Hays State campus and spend some time with the campus and also with the community.
Yes, they get to stay the night, usually in McMidas Hall. That's where they stay the night at. And then the next day, usually the last day of the experience, they go to Hays Medical Center and they shadow nurses on the floor. and they get to choose usually which nurse they would like to follow, so which floor.
And how long is the experience?
It starts usually on a Wednesday or a Thursday, and we start about noon, and then that goes all the way until the next day till about 3:30.
Now, are these students from across the state, Jana?
Yes, and we've even had some out of state, so that's been wonderful.
Is there a reaction from the students? What's the feedback you get?
We usually hear great experience. They love it. It either determines if they want to be a nurse, where they want to go with their careers, their college careers. So that's awesome. So we hear good things.
Thanks to the University Relations news release, we had some of the comments from some of the students who attended. And it's really quite remarkable about how you reach these students. It's rather amazing that the students get feedback to you
Yes.
from the feedback you give them about the nursing experience.
Yes.
One of the things we noted from one of the students was that they were actually using the mannequins for breathing experiences they weren't aware of.
Yes, they got to put on stethoscopes and they got to listen to our high fidelity simulator. SimMan 3G is what we call him. And he breathes, he has a heartbeat, they can hear all of that. So they got to hear that. Bowel sounds, he has pulses, he can cry, he can sweat, he can throw up.
Oh my
You name it,
goodness.
he can do it all. So
Oh my goodness.
yeah, so they had a great experience with him.
Now, tell me about the nursing program overall. When students come in from the time they graduate, what's the progression here, Jana?
Usually they have some pre-nursing prerequisites to take and some general education courses as well. It usually takes most students, unless they're coming in with courses, about 2 years, and then they will come into the nursing program and finish that in 4 semesters.
Give us an idea for those who might be interested, who might see this program, about the prerequisites. What's needed?
Prerequisites would be like biology, chemistry, anatomy and physiology, let's see.
All things they'll be
Human growth
using.
and development, yes.
Growth and development,
Absolutely, nutrition,
okay.
all of those things.
A lot of things that nurses deal with
Yes,
on a regular basis.
every single day, you got it.
The program brings in students to campus for this brief period of time, but then it gives them an opportunity to explore further the career of nursing, is that right?
Yes, we actually had a station during the Nightingale experience where they got to see the curriculum and the grade point average they need to have, all of those things in order to hopefully get accepted by the time they come here and get through their prereqs.
Many of us have, of course, obviously experiences with Hayes Med. The nursing staff is usually the first interaction that patients have.
Yes, definitely.
And it's always a positive experience. There's something about nurses that as they relate to us as patients, as human beings. What are those qualities, Jana?
I think nurses just have to be really good communicators. We can have empathy, sympathy with our patients, but most of all, we have to listen. We have to listen to what our patient's telling us. So that's important.
And do you find those qualities in most of the students who come during the Nightingale experience?
Most of them, yes, they are good listeners and they communicate well with the nursing staff here as well as nursing staff at Hayes Med, so they do very good.
And then you find that some just don't think nursing is for them, so they move into other areas then.
Yes.
What's the percentage? Any idea?
I don't know. We had lots of good positive feedback of people who said nursing is definitely for me this semester, so I don't know what that percentage would be.
What about a couple of other feedbacks that you might have gotten from those who were experiencing those 33 students in the Nightingale experience this year? What did they tell you?
They really liked the hands-on here in the lab. They really liked that, and they also liked to know what their college courses options were early, because some of them are able to take that, ahead of time before they even graduate high school. So lots of them are big planners in that area, so that's good.
And as far as course curriculum, the Fort Hays State University campus can provide some of that, or should students in the high school level, you say these are juniors and seniors, should they have a good background in chemistry, biology, some of those types of things?
Yes, definitely, and they can find that curriculum on our website too.
Okay,
Yes.
and that is what?
FHSU.edu and then nursing.
All right, simple as that.
Yeah,
then.
simple as that.
And it gives kind of the outline of the overall picture of nursing at Fort Hays State?
It does. It breaks it down kind of in a block schedule, how they would take classes each semester. Of course, we know that we're flexible with those courses, and you may take one before the other, but that's okay.
And it can be kind of designed to the student and their interests then.
Definitely, most definitely, especially their general education courses. Yes.
Jana, I wonder if you were aware of the long tradition of nursing back to the days of Leora Stroop, for whom Stroop Hall is named, that the campus, Fort Hays State, the Department of Nursing has a long history with the university.
Oh yes, most definitely. And we even do a Leora B. Stroop Award during graduation, so that's something that the student can get based on professionalism, academic excellence, in classroom work, so that's wonderful.
Furthering that basis
Yeah.
that Leora so many years ago established here at
Yes.
Fort Hays State.
For sure.
That's a great program. Anything that we haven't mentioned that you'd like to mention to folks who might be interested in a student of theirs who might want to explore a career in nursing as such?
Usually the Nightingale experience, about November, December, we post the next summer's experience on our website, so be looking for that. And we also send it out to the guidance counselors, so that would be when that will be coming.
So guidance counselors can be looking for that. And this is a program designed for juniors and seniors then?
Sophomores and juniors.
Sophomores and juniors?
Yes,
Okay. And throughout Kansas, or in the area?
Yes, exactly, Colorado, Nebraska.
And once again, that website, Jana?
fhsu.edu/nursing.
The Assistant Professor of Nursing at Fort Hays State University. We're in the lab of Stroop Hall on the campus with Jana Zeller, our Community Connection.
Angels Care Home Health, serving Hays and the surrounding areas, is a Medicare-certified home health agency providing quality skilled nursing and restorative therapy services to patients in their homes.
And the Angel Care nurse comes to see me once a week.
Angels Care is there to help 24 hours a day, and all services are covered 100% by Medicare for patients who are eligible.
Angel Care has helped to stay home.
Angels Care Home Health. We serve patients.